Good morning, good afternoon, everyone. Keith Ward with DWISE. I'm here with Andy Richardson and Scott Balhouni, both senior consultants at the DWISE Life Science Practice. We're excited to bring you this webinar. It seems to have a lot of attention and give you an overview of a powerful approach to CDISC assessment and implementation. We expect quite a few people, but while we wait for everybody to connect, let me address a few quick housekeeping issues. The webinar will be about 45 minutes and will be followed by a 15 to 20-minute Q&A session. Everyone will be muted during the presentation, so we ask that you ask questions via the questions tab in your control panel. Today's webinar is being recorded, and we will be sending a link to all the attendees and absentees a few days after the event. And during the question and answer, we'll answer as many questions as we can, but we do promise to send you a summary of all the questions that were asked and an answer. And there will also be a short question survey that will be served up after the webinar ends. We'd really appreciate your input on that. So looks like we have our close to attendance here. So without any further ado, let me turn this over to Andy Richardson and Scott, our senior life science consultants. Andy?
Thank you very much, Keith. Welcome all. The subject of today's webinar is a method that we've developed here at DWISE and are using to help companies understand where and how they are implementing the CDISC standards in their operations. And for the next 30 minutes or so, we would like to introduce you to the method and show you some examples of how it can help in understanding various aspects of standards management. Before we go into the main body of the webinar today, I think it's a good idea just to remind ourselves where we are in the industry and some of the challenges that people find implementing the standards operationally. So first, the development and adoption of the standards is now well established, and they are, of course, the required standards for submission, particularly to the FDA, but also increasing by other agencies, for instance, the Japanese. And shown here are some reasons why realizing their full potential operationally is perhaps proving challenging. There's the different standards across the study life cycle, the governance issues that they introduce, just the day-to-day way of working with standards in the organization and confirming compliance. And I'm sure you can probably think of other examples too. Today's webinar, let's be clear, is not about the standards themselves. We leave that to others for another day. What it is about is how they're incorporated into the daily clinical data operations, and specifically a way of describing this that gives a clear view of which standards are being used and where, the clarity of how they're being used, and a robust method and the opportunity to review and test the different approaches to using them within the organization. And we refer to this method as developing standards operational models. For the rest of the webinar, I will describe briefly what a standards operational model is and how to create them. Then Scott will present an example of a fictional but realistic example of a standards operational model and discuss some insights that can be gained from them. And then in the final section, I will show how using some more formal methods, the approach can be used to document and support data requirements, and we will close with some summary statements. So, to no more ado, what is a standards operational model? Well, it's a schematic representation of how an organisation is using the CDISC standards over the study life cycle that shows the state the standards exist in as they are used. And here is a typical, simple, generic example of a standards operational model. How does one go about developing them? Well, as you seen from the previous slide, the fundamental here is a matrix formed from the standard and the operational states, and shown here to form this kind of grid. The example here shows the clinical data standards presented as using the same general categories that CDISC use on their website under foundational standards against a set of operational states. And having confirmed the operational states as they exist in practice, then we can start, having completed this grid, we can start filling in the details of the standards themselves. So here we have the grid again, and we can start by putting in the actual details of the published standards of interest. Then the details of any modified standards, for instance, that may be variations on SDTM for internal use, followed by any user standards. For instance, here we see a CRF library. Having established the range of standards that are being used in an organisation, we then can move to put in place the details of those standards that are available or being used actually to define a particular study. And finally, we can add the study artifacts that will be built from the standards. For instance, the data sets or the data collection forms. Having done this, the next step is to build in the operational relationships in this grid, how one standard or artifact is related to another. The basic relationships being here between standards, for instance, standard SDTM at version 313 is related to SDTM standard at version 312. It's a new version. We can put the relationship in of implemented standards, where a standard is used directly as a study specification or indirectly as the basis for other standards. Here, CDISC, for instance, is being used as the basis for a CRF library. We recognize mapping relationships, the rules for converting between the standards. And finally, data transformation relationships, showing which artifacts are related to one another. And at the end of all that, we need to join the standards, the artifacts to the standards themselves, so we have compliance or validation relationships. An important, just minor aside here, but important note that these arrows on these diagrams represent changes in state rather than changes in workflows, and this becomes important later on when we look at the more formal models. So having built this picture of how the standards are being used within an organisation, they're now available to explore different aspects of how they're being implemented. And what we are finding here at DWISE is it's helpful, before delving into the detail, just to consider why any one of these standards has been adopted. This helps later on, and Scott will explain, how to test the findings from having created these sorts of models. We would offer that there's 3 reasons mainly that people adopt the CDISC standards. For instance, to support the creation of accurate, high quality clinical data artifacts, to ensure compliance with regulatory authority requirements, or to realise standards-based operational efficiencies. Of course, for any one standard, however, the primary goal may not be in this order. And in our experience, for example, it's often the case that this is actually the primary and priority reasons for introducing the standards. So having established what standards operational models are, I'd now like to hand over to Scott, who will present some more detailed examples of how they can be used in practice. Scott, over to you.
Thank you, Andy. So as Andy mentioned, if you go to the next slide, I'm actually going to walk us through an operational model for a fictitious pharma company appropriately named ABiopharma. Although the example itself is fictitious, I suspect that certain elements should resonate to those of you on the webinar. As we step through this example, we'll examine how ABiopharma can use our methodology, as Andy mentioned, to test aspects of their standard operationalization. And it's the same methodology that can actually help you assess various aspects of your standards operationalization. Before I speak to some of the more complex details on the diagram, what I'd like to do is briefly explain the framework that Andy talked to a bit before for ABiopharma's standards that are being implemented across the top row of the diagram, as well as the implementation, that first column on the far left. So as we see across the top, there's various standards that have been implemented by ABiopharma. For example, ABiopharma has 6 different data collection standards, including CDISC, CRF, an ePro standard, as well as a few others. They also use SDTM for their data tabulation to be compliant with regulatory requirements, but you'll also notice that they use an extended SDTM or an SDTM Plus for data collation activities such as data cleaning or medical review. Now, in the first column, we'll note some of the implementation types that are in place at ABiopharma. They use the published standards and then modified versions of the published standards, which include extensions to CDISC controlled terminology, or also may include standards that are wholly developed by ABiopharma, such as their protocol template or their study analysis plan template. And you'll notice there in the third row that their adopted standards are specification-based. And it's these specifications that are used by their study teams to actually implement the standards for various resourcing types. And as you'll notice in this diagram, there are actually 3 different resourcing types that are presented here. We have a resourcing type for a study that's wholly implemented internally by ABiopharma. We have a study that is run by CRO-A using ABiopharma standards. And finally, in the last column, or last row, excuse me, we have a study implemented by CRO-B that is actually disconnected from ABiopharma CRF standards. And this actually gives us the first opportunity to show the power of this methodology we've developed here at DWISE. So if we focus on that last row in the diagram, you'll notice that the eCRFs that are in use by CRO-B are not connected to ABiopharma CRF standards. However, if we navigate to the right of the diagram, you'll see that the SDTM that's delivered by CRO-B actually needs to be compliant with ABiopharma's SDTM standards. So might this disconnect actually cause a problem for ABiopharma? Simply by creating this model and evaluating this diagram, DWISE in collaboration with ABiopharma can actually address this question. So let's look at another example of how we can use this model to actually test ABiopharma standards operationalization. So as you'll notice that like Biopharma has actually implemented, as I mentioned before, an extended version of SDTM for their data collation activities. So you will note the blue lines that connect this extended version of SDTM to their pure SDTM data tabulation standard. So as a result of this connection, anytime that Biopharma updates their SDTM standard, as you'll notice that they're doing here, where they're going from SDTM 3.13 to SDTM 3.2, there's an impact on their data collation standards. So again, is this the most efficient way for Biopharma to actually implement and operationalize their standards? Again, our methodology is enabling Biopharma to identify this question and then collaborate with DWISE to actually determine whether they are doing things in the most efficient way. Let's look at one final example of how we can use this methodology to actually test Biopharma's standards implementation. If you'll notice on that third row, the yellow mapping lines between the data collection standards and the SDTM standards. What this indicates is that all mapping is actually occurring at the specification level. There's actually no relationship that are defined between Biopharma's use of the published standards and the modified standards in the first two rows and their SDTM or data collation standards. So again, just by putting this diagram together, using our methodology, we can evaluate, is Biopharma's operationalization by having their mapping wholly in the specifications the most effective way to manage or to create their standards operationalization? Again, Biopharma and DWISE can actually collaborate together to answer this question. So if we go to the next slide, this is where we actually get to see the real power of this methodology. We can start to overlay the initial graph with some other information, such as in this case, our standards application. So here we have the data management system. We have SAS. We see that Biopharma is also using Excel as part of their standards operationalization. We see they have an MDR. And finally, we see that they're actually using Pinnacle 21's system for their conformance evaluations. So you'll notice, if you look at this diagram, that Biopharma is managing their SDTM standards, their data collation standards, and their ADAM standards using the MDR. However, they're exporting all of their content from the MDR into Excel for use by study management teams. Again, is Biopharma maximizing the benefits of their MDR? Simply by overlaying this graph with the applications, we can expose that question. And again, Biopharma and DWISE can collaborate together to ensure that Biopharma is maximizing the use of their MDR. So let's look at another overlay. So if we go on to the next slide, we can examine how the organizational groups are actually interacting with the standard. So for example, we have their clinical operations group that's responsible for the protocol, as well as responsible for non-CRF standards. We see their data management team is responsible for part of the data collection standards and then responsible for the development of the data collation layer. We see that the stats and programming team is responsible for creating submission-ready SDTM, as well as the analysis deliverables. And then back at the study planning level, they're responsible for the study analysis plan, as well as the SDTM trial design data sets. And finally, we'll see that the standards management team is responsible for maintaining the standards for controlled terminology, data collation, data tabulation, as well as ADAM. Again, if we look at this overlay, we notice that the data management team and the clinical operations team are both responsible for certain aspects of the implementation and the definition of data collection standards. Again, is this the most effective operationalization for Biopharma? Simply by using our methodology and collaborating with DWISE, it will enable Biopharma to actually make that evaluation, determine if they're actually operationalizing their standards and making the most effective use of resources within their organization. So as I mentioned earlier in the presentation, if we look at those yellow lines that are the mapping specifications, or the mapping between our data collection standards and our SDTM or data collation standards, all that operation, all that work, all that mapping is actually being done by the operational teams, such as data management or statistical programming. Our standards management team is not involved in that activity. So again, is that the most effective method for a biopharma to operationalize their standards? Should we expect to have our standard SMEs involved in developing these mappings? Again, this simple overlay to this methodology will surface that question and allow DYs and a biopharma to address these questions together. So again, if we go to the next slide, we see that the possibilities for overlays are nearly endless. Here you see where we have the organizations now overlaid with the applications. And again, if we look on this graphic, we'll notice that it's the standards management team is the only organization that's actually playing around, if you will, in the MDR. All of the other operational teams are using Excel. Again, we take this seemingly simple graphic, do some overlays in it, and it exposes, a really challenging question. Are we maximizing our standards operationalization at a biopharma by requiring our operational personnel like our data management team or our stat programming team to start with Excel rather than pulling content directly from the MDR? So just to kind of summarize where we are and go to the next slide, these complex graphics really illustrate the need to ensure that CDISC standards management and implementation are aligned, and they allow you to explore your operationalization of the standards and expose issues and inefficiencies. Further, these models clearly identify which standards are in use and how they interact during the study lifecycle. And finally, overlays can be added to our methodology, such as the operational team, such as applications, such as business processes, such as IT infrastructure. So again, it allows you as an end user to expose potential issues or potential challenges or inefficiencies with your standards operationalization. And then these DYs can help you address and answer some of the questions that may come up simply by using this methodology. Now, I'd now like to turn the presentation back over to Andy to kind of walk us through a deeper layer, another aspect of how our methodology can help companies like a biopharma and yours meet data traceability requirements.
Thank you very much, Scott. What we'd like to just do now in the final part of our webinar is to demonstrate how the technique can be used when these relationships, which Scott has explained in detail, are represented more formally using graph methods, and show an example, as you said, of how they can be used to help answer data traceability questions. This slide here shows a version of a standards operational model developed to understand how a study's demography data was being defined and consumed. This front end is a graph application, which some of you may be familiar with. If we zoom in on various parts of this diagram, we'll be able to see that it has the same elements that Scott has discussed, but in this case just managed in a different way. So here in the top left we have the set of data collection standards. In the middle we have two versions of the SDTM standards supporting data tabulation. And on the right, we have the ADAM data analysis standards. Along the bottom here is shown a study, their specifications and their artifacts. So here we have data collection specifications and artifacts, data tabulation specifications and artifacts, and data analysis specifications and artifacts. And you will see that all these are connected by lots of lines which are the same as the ones that we've presented earlier in the more matrix models. So we can use this approach to answer questions such as what is defining, creating and manipulating the demography data, or what is using the demography data. So in this tool, by selecting and clicking on the raw demography dataset, the paths to and the paths from this dataset can be instantly displayed. On the left, here are the paths to, the predecessors of contributing to the demography, and on the right, the paths from the demography dataset. All the elements that have contributed to creating the demography dataset are clearly shown. So we can see the protocol, a mock-up of the CRF library, which is here, the forms, and how they have been related and used the CDISC. Similarly, on the right-hand side here, we can see how the raw demography data set is used. For example, it transformed into another data set, also called DM, here on the right. We can continue this approach for any object that's on this picture. Let's just stay with the demography data set and look at it within the data tabulation area. So clicking on here, now the path to on the left includes both the CDISC standards from data collection and the SDTM standard that's being used for data tabulation. But note that here we only see the standard that's in used, SD 1.3. The newer version is not represented here because it's not being used for this particular study. And now we also see on the right-hand side a more detailed version of the paths from, showing here that the demography data set is being used as a contributory element in an ADSL data set. And we can continue this idea throughout the model. So if we now look at the ADSL data set, we can see that the path to now includes all three contributory standards and new SDTM objects that are contributing to it, which the one I'd like to point out particularly is that it's added a trial arm data set defined from the protocol in terms of the trial design data set work. On the right hand side, now of course the path is minimal. This is the end of the line, and it is showing in actual fact, the purple line, that this data set needs to be compliant with the ADSL standard, which is implemented in this program, which is correct. So that's just a short demonstration of how the underlying method can be used for really quite important aspects of a study's use of the standards and data traceability. So in conclusion, we hope that we have been able to show you a powerful method that can be used to describe how an organization, your organization, can define and how your standards are being used and where and when. And that by using the mapping overlays and similar techniques that Scott particularly spoke about, that many different aspects of the management of the standards can be instantly realized and analyzed. We are aware that the value of the model is best realized probably at higher levels of granularity. What we haven't seen here is any details of the individual domains that represent any one of the objects that are subject to the standards. and they are, we're finding in our hands that they complement well with other well-established approaches for developing processes, describing technical requirements, etc. And that finally, as we move to represent these models more formally as graphs, we can exploit powerful features to support other aspects of the clinical data requirements, such as traceability and audit trails. I will now hand back to Keith, who will take us through the final piece of the webinar. But first, to thank you for your attention. And here are mine and Scott's contact details, should you wish to follow up in due course. Keith, back to you. Thank you.
Thank you, Andy. Thank you, Scott. Very, very informative. Nice job. Well, we have a few questions, but if you have questions, you can certainly still submit them via the question tab there. But to get a few questions, perhaps Andy and Scott, you can help answer these. First question from Sue is, in the data traceability examples, could you please explain what the orange ellipses represent, as they aren't on the earlier operation model examples?
Yeah, thank you. Yes, that is a slight modification to the models that we presented earlier and Scott discussed. Those actually, these ellipses represent the actual tool or the method that is performing the transformation from one state to another. So what you saw there was that they would represent mainly actual programs.
Okay. Second question here from Tom is, in the first example, the mapping between the standards seems to be only at the study level. Is that correct? Aren't these usually included as part of the MDR?
Scott, would you like to take that?
Certainly. So the mappings themselves were actually at the specification level. So ideally, yes, the mapping should be in the MDR. And actually, the graph that we showed actually did expose sort of that issue, if you will, with a biopharma's implementation of the standards, that they did not have their mapping specifications of the relationships between their standards in the MDR. And that's something, again, as if this were, if a biopharma was an actual company, this is something that DWise and a biopharma could analyze and sit down and decide how best to address that together.
Okay. Thank you, Scott. And next question. You've included control terminology as a separate standard in the examples. Why?
The control terminology actually extends across really all of the different data standards, if you will. It impacts your collection, it impacts tabulation, and it impacts analysis. So we called it out as its own standard or as its own entity, if you will, so we could show that it does impact all of the other different data standards that are in use by this company.
Okay. Another question, let's see. You said the arrows represent changes in state and not workflows. And having SOPs is a regulatory requirement. Is it not clear where the processes are? Can you please explain that?
Yes. The arrows are. The arrows represent the transition, and they imply the existence of a process to move from one state to another. So as you develop one of these models, we haven't demonstrated it here today in the examples, but you can overlay those arrows with the details of the process. Now, that process may be an SOP and manual, or it might be completely automatic, as is in the case of a data transformation. And the power of recognizing that the arrows are not themselves workflows, but rather changes in state, enables these maps to be built accurately for the way that the procedural and the regulatory requirements on moving between these points can be realized.
Okay. That's all the questions I have at present, but certainly you can continue to ask questions. You'll get a thank you email from us after the webinar. Andy, could you just advance to the next slide, please? So this URL on our website, CDISC Fitness, is a way for you to get in touch with us, to receive more information, or perhaps speak to an account manager about DWISE's CDISC capabilities and standards, strategy, implementation and governance capabilities. There are also within the control panel here some documents under handouts that will also provide more information for you. And as I mentioned in the opening, it would be great if you would help us out with filling out the survey that will appear after we shut down the webinar. I think that's it. Andy, Scott, anything to add, or are we pretty much done?
Unless there's any more questions, thank you very much.
Thank you, everyone. Have a great day.